this month, apart from it being Heritage Month, and congratulations on Amerindian Heritage Month, I think you should give yourself a big round of applause for that. The dances and the poems and so that we've just seen show that you maintain the heritage of the community. The prayer, that's another good thing, that you're praying in your language, which is so important. We need to do more than that. We have 9 different indigenous languages. Some time ago, we have developed dictionaries for 7 of them. We have developed grammar books for a number of them. But if we don't teach the language to the children, then these languages are going to disappear. And it is not only disappearing here. All of the 9 languages that we have in Guyana are listed by UNESCO as endangered languages. So if we don't invest in teaching the next generation about them and they disappear, then we would lose them as a country, as a people. But what would also happen is that the world would lose these languages because they are unique to this part of the world. And if we lose it, that's it. Nobody else in the world is speaking it. So we need to start coming up with strategies of how we are going to preserve our languages. And if it is that we have to work with you, I know some of the older folks, they'll know it, they can speak it. Some maybe might be able to write it, but we have to work with you so that you can teach this in the schools. Get more people to understand it. And some of the poetry and the things that you do, the songs, we have to encourage people to write in these languages. We want to see the poetry in the language. And that is not impossible to do. We want the stories of the village to be in the language. And one of the projects that I wanted to do was to do bilingual books. So one in the indigenous language, let's say Mapuche, and it's translated in English. So if you got one page is Mapuche, the other page is English. And in that way, we'll have information, we'll have books. We must write poems, we must write songs in these languages. That's one strategy in which we can sustain the language, and that's very, very important. So I urge you to continue the work that you've been doing in terms of keeping the language alive, but I think we need to do a little bit more, because if we're not careful, they will disappear and they will disappear forever. So we owe it to these children who are around us to make sure that we teach them and we preserve these languages as part of the legacy of the Amerindian people in Guyana, because you have a rich legacy.
Those were the remarkable words from the Minister of Health, Honorable Dr. Frank Anthony, as we are still observing Amerindian Heritage Month. Between September 8th and 9th, the Honorable Minister visited Region 9, where he engaged in several activities within the hinterland region and its sub-districts. On September 8th, 29 students from Region 9 were inducted into the Ministry of Health's Pharmacy Assistant Program. This is the first batch of students for this particular program, as the region forms part of the ministry's effort to decentralize its training programs. Over the next 9 months, the students will be trained with adequate knowledge, skills, and ability to provide technical support to licensed pharmacists. During his brief remarks, Dr. Anthony encouraged the selected candidates to work hard and pursue a profession in the health sector, and assured them that upon completion, employment with the ministry is guaranteed. On the same day at Napi Village, the Comprehensive Child and Youth School Health Screening Program was launched. This first-time initiative is a collaboration between the Ministry of Education and Mount Sinai Health Systems and is intended to improve the health of school children between the ages of 5 and 17 across Guyana. While in the Upakari Village, a $14 million staff quarters fully equipped with solar systems was commissioned under the Regional Health Services budget. Health Minister in his remarks stated that as part of the ministry's effort to improve healthcare and service delivery throughout the country, some areas will need to be staffed with additional healthcare professionals. Hence, the building was constructed to make provisions for healthcare workers being assigned to the facility. He further stated, apart from the infrastructure upgrades, the health workers in the community will soon benefit from online training through the telemedicine project.
The telemedicine equipment that we have, through that equipment, we can also do training. So where we need to connect to the internet to get access to health material and so forth, that can be done using the equipment that we currently have and the connectivity that we have. We have a program where we're training people to become registered nurses. So if you have persons from your community who are interested in that program and meet the eligibility requirement, then certainly we can bring some of you onto that program, and you can go right in that telemedicine space when it's not being used with a patient, and you can go through the different lessons that are there and so forth and learn. So it's not just a piece of equipment that can be used just for diagnosis and so forth or connecting to the doctors. It can also be used for training.
Meanwhile, on the following day in the village Quaco, a $40 million health post was commissioned to serve the residents and provide services for maternal and child health, prevention of mother-to-child transmission care, and other clinical services. During his brief remarks, Minister Anthony highlighted that $243 million was allocated to the region for the improvement of hospital facilities. From this allocation, he noted that 3 regional hospitals will be built with the capabilities to perform surgeries.
But while we build these facilities and build them in your village, we also recognize that we cannot provide all the care that you need at the village level. And so one of the things that we'll be doing is also trying to improve the hospitals. And this year we have given another $243 million so that we can improve the hospital facilities within the region. So right now, we are going to be building at St. Crete, we're building at Aishalton and at Karasabay, adding theaters and other sections so that these hospitals can now do surgery. And this is what we want to see developing in the region. You must have capacity closer to where you are so that things like surgery and so can be done not far away from you.
In addition to the commissioning of the Quaco Health Post, a $7 million staff quarter was then commissioned in the compound of the Shalinab Health Center. During his brief remarks, Minister Anthony stated that with good working and living conditions within the hinterland communities, it will be easier to retain doctors and other staff who would have moved to the area. In closing, Dr. Anthony noted that the ministry is working closely with NDMA to establish connectivity sites across the hinterland regions.
We are also looking at how do we connect our health facilities. Connect meaning having some internet capacity. We have been working with the NDMA, that's under the Prime Minister's office, and they have said to us that they will give us 50 sites for the interior of Guyana. So I've asked Dr. Makwat to work with the health team so that we can identify different sites where we can upgrade the connectivity. And I'm sure this is a big enough community. I'm sure this would be one of the sites that we can use to improve the connectivity. With improved connectivity, we can also put in telemedicine capabilities. This is equipment, computer equipment that can be attached to the internet. And then if you have any difficulty whatsoever, you can dial up the doctors at Lethem or dial up the doctors at Georgetown Hospital so that they can guide whatever process or procedures we need. So this would add to what we can do and the capabilities that we can have in the region.
Moreover, on the same day, Minister Anthony and his team visited the Merriwell village where they attended a heritage ceremony hosted by the resident, along with the recommissioning of his health post and the commissioning of a newly constructed sanitary block. With a total of $9 million being spent on the overall upgrades to the facility, healthcare and service delivery are expected to be boosted in the community. While in Region 9, the minister also conducted site visits to several health facilities: Napi Village, Kotato Village, Hiowa Village, and Yupakari Village. He also inspected the works being done at the Anai District Hospital, the infectious disease building and healthcare facility in Lethem, and the construction site within the Lethem area that is set for a training center and administration dormitory. On Saturday, September 9th, Guyana joined its CARICOM member states to commemorate Caribbean Wellness Day and Caribbean Wellness Week under the theme Power Through Collective Action, with sub-theme The Care We Need at Work, at School, at Home. To observe this day across Guyana, a community health fitness walk was done. Over 400 persons, including top government officials, members of the diplomatic cooperation, and other private sector partners, were in attendance at the Georgetown Walk, while over 100 attended Region 9 Walk. Delivering the feature address at a simple ceremony held in Georgetown was the Permanent Secretary of the Ministry of Health, who in his speech advocated for Guyanese to practice healthy lifestyles to prevent non-communicable diseases. Meanwhile, in Lethem, the Honorable Minister of Health participated in a health walk organized by the health officials in Region 9. At the end of the walk, he appealed to the people to change their lifestyles and make healthy choices. He further explained that it has been observed that persons are no longer walking due to them traveling in vehicles wherever they go, and as such, this can lead to obesity and several complications that are related to NCDs.
We need to get more people to exercise and exercise regularly. And that is why in the whole Caribbean, the heads of government, presidents, prime minister, recognize that this is a very big problem. And so several years ago, they decided to designate this day, today, as Caribbean Wellness Day. But more so, to take the entire month where we can lift the awareness of people so that they can understand the importance of fitness. And that's what we want you to do today. We want people to start changing their lifestyle and to ensure that every day they do at least 30 minutes of exercise.
On Monday, the Georgetown Public Hospital Corporation resuscitated its trauma team training at the Project Dawn Healthcare Center, Liliendale, East Coast of Demerara. Through a Guyana $6 million grant that is being supported by the Canada Fund for Local Initiative, for the next 3 years, approximately 100 providers and at least 20 instructors are expected to be trained. In expressing his gratitude to the Canadian government for their steadfast contribution towards Guyana's health sector, Minister Anthony highlighted that through their collaboration, Guyana will soon benefit from an ultrasonographer and CT scan technician program.
We also have another program that we will be starting shortly, and that is to train ultrasonographers, technicians in ultrasonography. This is a new program, but we think that this is absolutely essential if we are going to have more people having access to ultrasounds. And we want to start another program in CT scans.
He further noted that with the infrastructural development of the health sector, more focus needs to be placed on the management of A&E care. In closing, Dr. Anthony emphasized the need for such training where persons will learn the necessary skills to work more effectively with patients in this care. Minister Anthony on September 13th met with a team of nursing tutors and nurses who were selected from the various nursing schools across Guyana to attend a training program in Brazil from September 17th to October 1st. The training program is being sponsored by the Pan American Health Organization and is geared at acquainting the group with online session approaches. Hands-on training in labs, stimulation centers, and primary care settings are among some of the areas that will be examined at the Birora Preto University Hospital. Meanwhile, on Thursday, digital X-ray system and rooms were commissioned at 3 health facilities in Region 6. These facilities are Mewikuri Hospital, Port Morant Hospital, and the New Amsterdam Hospital. While delivering brief remarks, Minister Anthony noted that with the new digital X-ray system, a person's chance of being exposed to radiation is minimal, and the image can be seen from different perspectives. This has brought us to the end of our review. Do be safe until next time.